Right, okay, year 11. I've said I'll do this for ages, so here goes nothing. I'm hoping it won't take too long, but we're about to find out. Please do not watch this in one go. So I'm going to go through all of the, let's say, essential knowledge for medicine through time, but please do not watch this in one go. Watch it to check that you're not missing anything, compare your own notes to it. But yeah, medicine through time. So firstly, big picture, there are 4 time periods, as you know: Middle Ages, and Renaissance, Industrial, and Modern. And the 3 words you want to talk about a lot is something that makes you sick, aka the cause of illness. If you're not ill, how do you prevent yourself from getting ill? And if you are ill, how do you then treat it? So they're the big things that we'll cover in the video. So I've taken the specification, so I shouldn't miss anything out, but obviously compare this to your own notes as well. So first thing we've got to know about is you've got to know about cause in medieval England, which is 1250 to 1500. So there are a few different things we need to know here. Supernatural causes are things like astrology. So you've got to know your movement of the planets. Very basic, the idea that the planet's movement may cause you to become sick. Religious explanation is the idea that it is God's punishments that you become sick. So that could be for a number of different reasons. You could have been a sinner. You could have not gone to church enough, not paid enough money to the church, anything like that. And that means that God is the reason that you are sick. There's also some rational explanations, like the theory of four humours. Theory of four humours came up by Hippocrates. He said that there were 4 different, shall we say, humours, aka substances: yellow bile, black bile, phlegm, and blood. And if they become imbalanced, you then become sick. Galen carried this on further, and he created the theory of opposites. And this is essentially the same idea, but it just means that you treat it using the opposite. The one I would remember is if you are wet and cold, think about your own lives. That means you might have too much phlegm. So you could talk about wet and cold, meaning too much phlegm. Last but not least, we have miasma. So miasma is very simply the idea they would believe that bad air makes you sick. Now, for all of the time periods, cause is the most important one, because a lot of this is common sense. If you remember what causes an illness, you therefore should know about how they're going to prevent and treat it. So, for example, if you look at the above, how do they prevent and treat illness? Well, bloodletting and purging, they would do that in order to balance the humours. If we go to religious actions in terms of prevention and treating, they might pray, you might wear religious charms, lucky charms, I guess. Religious charms is a better idea. You might give more money to the church via donations. You might go to church more. So anything to try to either prevent or treat you. Purifying the air, meaning you might put herbs around your house to try and things to make the room smell nice. And this again links to the idea of bad air. So think about it. If you know what makes you sick, you therefore know how to prevent and treat it. In terms of who treats who, so physicians treat the rich. They are at university for 7 years. Barber surgeons, they learn by observation. They observe the physicians. That's how they do their job. They will do basic surgery, things like amputations and stuff. And apothecary is where you would go to get your herbal remedies. And if you can't afford any treatment, might be on the next page, you would go to your local woman, whether that's your mum, someone in the street. It could just be anything simple like that. In terms of other things to know about, I've mentioned medical training already, university. All of these people, so physicians, barber surgeons and stuff, they learn the work of Galen and Hippocrates. So that they all learn about the 4 humours. They don't challenge these ideas. They back them. They believe that they are true. Okay. Hospitals in this time period are essentially care homes. They care, not cure. So you don't go there for treatment. It's mainly old, homeless, poor people who go there. When it says care within the community, that basically means the local female. It could be your mum, it could be a woman who lives in your village who has some magic herbal remedies that she says. Herbal remedies, they're made up of different parts. It could be animal parts, it could be plants. They sometimes get correct because they use things like ginger, which can reduce inflammation, but a lot of the time it is absolute nonsense. They are the main ideas. Again, very basic, but that's the main ideas of medieval medicine. Every topic has a case study. So for the Black Death, it kills about 30 to 50% of England, which is outrageous, I know. And we're not exactly sure on the numbers, but it's probably between 1.5 million, 2 million deaths. This is because they don't know how it is spread. So the Black Death is a form of plague, bubonic and pneumonic plague. They have no idea, or can't spell mnemonic, ignore that, it's probably spelled wrong, you might want to check it. But it's a form of plague. They have no idea how it is spread. We now know it's spread by rats and fleas, but they didn't know that. So approaches to treatment and prevention, they do all the basic stuff. So they would do the religious actions, they would pray, they would carry herbal, always good when the phone goes off when you're recording. They would carry herbal remedies, for example. Any of those things are okay. So there's nothing unique about the Black Death in particular that's particularly different. When we get into the Great Plague, though, there is. Right, that is medieval medicine. Very simple exam question. The only thing I think I didn't talk about enough, which is like some extra points for medieval medicine, is make sure you have this idea that the church control everything. So there is a lack of education because the church controls education. The church controls printing. The church believes in miasma. The church teaches Galen and Hippocrates. So make sure you're really big on this idea of the church being very, very important. I think that's the main stuff I've done. I've hit medical training. I'm checking the specification next to me. That, again, very basic, but that's the main stuff complete. Right, now we move in to the Renaissance. 1500, 1700. Learn your dates. If you get your dates wrong, you are screwed on this paper. So 1500 to 1700. Right, first thing it says is continuity. And this means a lot of things stay the same. For example, they still pray. They still believe in the four humours. Therefore, they still have bloodletting. They still use purging. They still purify the air. So a lot of it is the exact same. There is no change. In fact, the majority of it stays the same. So there's nothing new to learn. However, there is a sort of shift. There is a slight change that becomes more scientific throughout the Renaissance. Although they can't prove it, for the first ever time, they start to challenge some old ideas. So let's look at some of the individuals who do this. So we'll start with Thomas Sydenham. Thomas Sydenham is known for observation. He observes patients, he looks at their symptoms, and then he categorizes them into a certain illness. So this is quite new because they used to just say you need to pray more. Now he's actually looking at specific illnesses. He is famous for distinguishing scarlet fever. So he comes up with the idea of scarlet fever, and he distinguishes it between measles. And he basically says before you treat, you must diagnose. And this is a new idea because many people had not considered diagnosis before. He writes his book in 1676, and his book is called Medical Observations. And because of the work he does, he's seen as quite an important person in the history of diagnosis, and he is called, nickname, the English Hippocrates. The next thing you get is the printing press. The printing press is a bit weird because it begins in the 1400s, but it's not used until 1500 in England. Therefore, it falls under this topic. Don't talk about it in the medieval. It doesn't count. And all it does is it spreads new ideas. So books like Sydenham's book can now be spread. Other guys we're going to talk about, like Vesalius, his book can be spread as well. And this reduces the influence of the church because the church were in complete control of all publishing. So the printing press is really important for spreading new ideas, for challenging old ideas. And another group that are very important in this, in the Royal Society. So they begin at about 1660, and very simply, they are a group of scientists who meet, they publish a journal, and again, printing press, they can spread that journal around the world. And what do scientists love doing? They experiment. They try new scientific ideas. Again, the important thing here is they are challenging old ideas. They're not simply accepting what Galen and Hippocrates has told them. One of the most famous, if you want a good example, is Richard Lower. In 1665, he completes a successful blood transfusion from animal to animal. He can't do human to human because they don't know about blood types. But Richard Lower is one you can use in an exam as an example of the Royal Society beginning to challenge these old ideas. The Renaissance is quite tough because there's not too much to talk about, which means you have to know the people really well. So now we talk about continuity and change when it comes to things like hospitals and treatment and care. So it's still very similar in terms of care in the community. You still see your women. In terms of treatment and stuff, again, very similar. You still have your physicians. Nothing has changed there. You still have your barber surgeons, your apothecaries, your herbal remedies. This is all very similar. But there are some quite key changes. Hospitals remain basically the same. The only difference is during the plague, they set up like a pest house where they do take in infected people. And during the Black Death, they wouldn't accept anyone in hospital. So there is some change there. So the big training is medical training, because physicians start to study the work of Vesalius at university and the work of Harvey, who we'll get onto in a second. So medical training doesn't change dramatically, but they're starting to look at a few different scientific ideas, more of a scientific approach. They're starting to challenge some old ideas. Two names you must remember. So Vesalius discovers human anatomy, your bones, your muscles, your joints. He writes about it in a book called The Fabric of the Human Body. This book is published in the year 1543, and it's the first book to really challenge Galen's ideas, which is really, really important on this course. So the difference is Galen used animal dissection. He was never allowed to dissect a human body. Vesalius uses human dissection, which means he's able to figure out the things like the bones, the muscles, and Galen could never do this because Galen could not dissect humans. One of the things that Vesalius proves is, as an example, he proves that we have one jawbone. And this may sound very obvious because you've never heard of someone break half your jaw. You break your jaw, don't you? Galen used to believe there was two jawbones. So this is a good example of Vesalius challenging Galen. And of course, his book can be published by the printing press, so people know he is correct. They can see his work for themselves. And again, this question of the Renaissance, they're starting to challenge old ideas. Final key individual is William Harvey. He's not under prevention, treatment, or cause because he doesn't really do anything. He's more about medical knowledge. So if he comes up in a question, it will be about knowledge. He discovers the circulation of the blood. Essentially, the blood pumps around the body using veins and arteries. Again, he therefore challenges Galen, because Galen used to believe it would go through like these invisible holes, which basically means he hasn't got a clue how blood is pumped around. Very easy for Harvey to see this. All you got to do is dissection. So after dissecting humans, he can see that the heart pumps blood around the body. He writes his book in 1628. So he is after Vesalius. So it's worth remembering that. So if you get a question on most important, make sure you talk, in my opinion anyway, about Vesalius, because he is the first one to challenge. So you must know, essentially, I think his book's something like Motion of the Heart and Blood. I'll put Motion of the Heart, but that's his book in 1628. And again, it's challenging old ideas. Both of these individuals are challenging old ideas by using science, things like dissection. Right, now we have the Great Plague, which sounds the exact same as the Black Death, but it is a little bit different. So only about 100,000, I think, die in London. It is less, or 100,000 in total, 100,000 the population in London. Sorry, that is in London. It's less severe, but they do have some changes. They use all of the same old approaches. So pray, herbal remedies, etc., etc. That's all the same, but they have some new ideas. Biggest thing is they start to quarantine properly. So they quarantine against the plague. Sometimes it can be as high as 40 days. People are told to stay in their homes, and they put a red cross on the door. In order to check that people stay in their houses, they have watchers that check, and when they think someone's died, the searchers go and check as well. So quarantine is the big change. The other weird and wonderful thing they do is they killed 200,000 cats. Oh, I think cats are 200,000. Should double check. 1,000 dogs. Yep, I'm correct. 40,000 dogs. This is because they believe the animals might be spreading it, and they are obviously wrong. So the big thing to talk about in terms of the change between Great Plague and Black Death is quarantine, Red Cross, watchers and searchers. And in order to do this, a group we haven't mentioned yet, the government need to get involved for really the first time. The king needs to get involved. They were not involved during the Black Death at all. So really, really important to remember that. But lastly, I'm going to tell you about the Renaissance. Little stupid story. 1685, Charles II is near death. I won't bore you with the whole story. This is towards the very end of the Renaissance, when essentially whatever hits the fan, they have to fix him. They go back to the old ideas. They bloodlet him, they purge him, he dies essentially. And it proves in the Renaissance, although they start to challenge old ideas, overall, they stick to the old stuff. Vesalius, Harvey, those kind of guys, they are more long term, all right? They are more sort of long term. Right, let's move on to the big one, most important one. Most likely to come up as an exam question. Most stuff to talk about essentially is the industrial. 1700 to 1900, but it really begins in like 1800. There's barely anything in the 1700s. Really important to note, out of all the events we spoke about earlier on, from this point on in the course, and the four humours do not exist. Any question from 1700 onwards, don't utter the name God or the four humours. They do not exist. Miasma does exist until germ theory. So it's really, really important to remember that. So when it says continuity, it means miasma is still believed by Nightingale, for example. When it says change, that means no God and no four humours. The other thing they start to look at is this idea called spontaneous generation, which is the idea that germs or whatever just makes you sick and it just appears at the click of your finger randomly, which obviously we know is not true. So Louis Pasteur, probably the most important person on the entire course. In 1861, medicine changes forever because he publishes germ theory. All germ theory is it's the proof that germs make people sick, but it is huge. It proves that microbes cause disease, bacteria causes disease, whatever you want to say. It ruins spontaneous generation, and it ruins miasma. None of these exist anymore. Germ theory is the answer to everything. The issue is, and this is not how science works, but this is how I draw it, Louis Pasteur can see on a microscope these are all germs. But when the French government say we need to create a vaccine, so I need to know what these germs are, Pasteur hasn't got a clue, which is where Robert Koch comes in. Robert Koch in 1870 can discover a specific germ for anthrax. So what we say, the fancy word, is he can isolate specific bacteria. Isolating specific bacteria means later on they can create vaccines because they can actually test them. First one he does is 1876 anthrax. He does a few others as well though. So for example, he makes tuberculosis. He discovers that in 82 and cholera in 83. Now, if you get a question on cause and cause only, I would say Louis Pasteur is the most important. If you get a question about prevention, about medicine in general, then I would mention Robert Koch because he is able to leads to more vaccines than Pasteur does. So if you imagine Louis Pasteur can just see germs, Robert Koch can identify them specifically. Other important people, there's a lot on this course. So hospital care gets a lot better. Florence Nightingale is sent to the Crimean War in 1854, which means pre-germ theory, she still believes in miasma. Because of that, she cleans a lot, ventilation, changes bed sheets, opens windows. She reduces the death rate from 40 to 2%. And she becomes a bit of a hero. Now, this course is about medicine in Britain, so you need to know about what she does really at home rather than what she does overseas, although this is important. What she then does is when she gets home, because she's a bit of a celebrity, and especially even more so after germ theory and stuff, people obviously realize hospitals need to be cleaner. She starts writing and improving training of nurses. So the training of nurses becomes professional. She opens a school. It's still the second best school in the world for nursing, the best in the country. She publishes something called Notes on Nursing, 1860, and she professionalizes nursing. When you combine this professionalized nursing compared to what we're going to look at with germ theory, and we look at how everything gets better in hospitals because things are cleaner, antiseptics, etc., hospitals change dramatically. They start to treat, they take in the sick. They are way more the hospitals that we think of today rather than the hospitals of the past. Right, a lot more for industrial, because it's a big topic. Already mentioned that on the previous page, so we'll ignore that. Right, now we get to surgery. Two big individuals in surgery. A lot of people get them wrong. It's really important you do not. James Simpson is an anaesthetic. Joseph Lister is antiseptic. And there's a way of remembering this. Antiseptic is getting rid of bacteria. That's why Listerine mouthwash is named after him, because it cures bad breath by destroying bacteria. James Simpson is 1847 with anesthetics. Joseph Lister is 1867. Why does this matter so much? Because this is after germ theory. Whereas to do anesthetics, you don't actually need any you don't need any knowledge of germs to be able to do this. So James Simpson discovers anesthetic. What this does is it numbs, it prevents pain in surgery. Means surgery is overall more successful. It allows longer, more complex surgery to be done because the patient is not writhing around. Some of you might know there is something called a black period of surgery in the 60s, which is where it's almost surgeons try a few too many complicated procedures and some of them go wrong. But for the most part, it's a huge improvement. One of the most famous things you can talk about is Queen Victoria uses it in 1853 on birth of her child. And that helps. I think it's a sixth or eighth child, look it up. But even so, just saying an exam, she uses it for childbirth. Popularizes it. It makes it really, really well respected. Some people are a bit unsure about it, because it's not religious, it's not natural, but overall it's a huge win in surgery. The other massive win in surgery, I should have mentioned, chloroform. That's the anesthetic that he uses. Joseph Lister realizes that if you spray tools with carbolic acids, you could therefore essentially clean it, remove the infection. So it reduces the deaths due to infection. Or antiseptics, I think the few years before it, in the early 1860s, there is about a 45% death rate. After the use of anesthetics, there's only a 15%, antiseptics, there's a 15% death rate. If you're wondering why still 15%, that is simply because they have not cured blood loss yet, which we will get to in a second. Carbolic acid can clean tools, can clean knives. It means that when people work in hospitals, they can clean their hands, etc., the tools that they're using, their utensils. Also, by 1890, leads to aseptic surgery. Septic surgery is where there are no bacteria present at all during surgery. So it reduces the risk of infection. So this deals with pain in surgery. This deals with infection in surgery. But blood is still an issue until the modern. Right, use of vaccinations. So we have the man Edward Jenner. 1796, he tests it. 1798, he publishes the first ever vaccination, which is where you use cowpox to cure, or not to cure, wrong language, to prevent smallpox. They have used something called inoculations before. An inoculation is where you give someone a small dose of the same illness. So if I gave you a COVID inoculation, I'd give you a bit of COVID. Whereas if I gave you a COVID vaccination, there might be COVID in it, but there'll also be lots of other substances, chemicals in it. I'm sure you remember the very strange story. He is doing research on milkmaids and he realizes that anyone that works with cows doesn't get smallpox. Smallpox was a very deadly disease. And long story short, he gets it, he writes about it, he tests it on a young boy called James Phipps, as well as lots of other individuals, and it works. And it's the first ever vaccine. And it's a huge thing in terms of prevention. A lot of people don't follow it for a while. And it's not actually until about the 1870s that it is properly used around the country and it's made compulsory. So vaccinations are not immediately believed. Again, some people think they are immoral or go against God or whatever. But by the 1870s, it is compulsory to have a vaccination for smallpox. Some of you may have read somewhere, but it happens in like the 1850s and 60s. That's true, but it's not really enforced. It's enforced in the 70s, and it essentially eradicates smallpox, no longer a disease because of it. This is all use of government, and the government gets involved twice in very big measures. 1848 and 1875 Public Health Act. They call for things like clean water supply, therefore a very strong sewer system, and that every town should have a medical officer. The difference between 48 and 75 is simple. This is not compulsory, which means people can just ignore it. 75 is compulsory, which means that councils have to actually listen to what is being said. So huge role of government increase. Think about the course about we're looking at changes between the two. Look at the huge difference in the role of the government. Now they're taking a massive role in healthcare. Why are they doing that? Because people can vote. More people can vote anyway. So the government has to start listening to people, or they will simply vote them out. Nearly done with the industrial. We've done a little bit more. We've already done Jenner, which is good. So cholera. Cholera is a waterborne disease. It is killing a lot of people in London, and a man called John Snow looks into this, and he realises through some observation, through tracking, that everyone in Broad Street near a certain pump is dying of cholera. He asks the government, they then remove the pump, and that reduces the rate. Now, you might be wondering, well, why haven't they done more to have clean water? Because look at the date. They have no idea what is causing it. They don't understand there are germs in the water. So although Jon Snow is useful, he is only doing it in a specific part in London. If you get a question on significance of him, he's not Louis Pasteur, he's not Robert Koch, he's not Edward Jenner. These guys are doing like huge things. Jon Snow is useful. Again, he's not pointless, I'm not saying that, but he's only a very local sort of guy. He doesn't do a lot on the grand stage for the whole UK. Right, industrial is massive. There are lots of individuals. I've gone through the basics here. There are a few other things you could talk about, but they are all the things on the specification. A lot of individuals, a lot of names, quite a few dates. Try to make sure you learn them. Right, then we move on to the modern. There is no end date for the modern. So if something happened a week before your exam, you're technically allowed to talk about it. You could talk about COVID. Number one bit of advice I always give for modern is think about you. Think about your life before you even read any of the stuff. What causes illness today? Well, you should know. How do we prevent illness? Think about what you are told to do in school. How do we treat illness? If you've had any parents, family, you gone through treatment, and that's not very nice, but think about it. Right, just think about your lives. And honestly, 80% of modern is just basic. So they realise that it can't just be germ theory that makes people sick. So they start looking at something called DNA, and in 1953, and Watson discover DNA. As they are discovering DNA, they essentially realize that there could be genetic conditions. So it could be a problem with your genes. You may be born with a genetic condition. That's nothing to do with germ theory. So, for example, they realize that you could, for example, have a higher chance of having diabetes, of breast cancer, depending on your problems. These are sometimes referred to illnesses you get from your parents as hereditary diseases because you inherit them from your parents. And that is because Crick and Watson discover the DNA in 1953. Easy one though. We also prove lifestyle factors. We now have proof that alcohol can cause problems. We have proof that smoking can lead to lung cancer. We have proof that not exercising, being overweight, all of these things, unprotected sex, all of these things, drugs, so many different lifestyle factors. And honestly, it's so frustrating the amount of you that get a question on cause of illness, and all you've got to do is talk about lifestyle factors and you waffle about other things, and it's easy. Cause of illness is lifestyle factors. The other big thing is diagnosis get better. So think, when you go to a GP, you have to diagnose something. What might they do? They might take your bloods. They might do a blood test. They might do a CT scan of your brain. They might do an MRI scan of a certain part of your body. If you had a bad injury, they might use an MRI scan. They might check your heart. They might use heart rate monitors, right? Just think about your own lives. If you go to a GP, how do they check you're sick? Blood tests, CT scans, MRI scans, right? All of this is to do with diagnosis getting better. Right, now I'll move on to the other big areas. The NHS is created in 1948. It is created by Nia Bevan after the Beveridge report comes out in 1942 and says a crazy statistic that about 6 million people in England had never seen a GP. And they realise that has to change. So they bring it under, again, government's big theme. They bring it under government's control. Therefore, it's funded by taxes. And it essentially means free healthcare at the point of use. So ambulances, it can be surgery, dentistry, doctors, GPs means general practitioners, aka doctors. You can see a nurse. There's so much you can get now. Free healthcare at the point of use, funded by taxes. Huge change to government role. I think we'll come on to science and technology in a second. Yeah, we will. So I'll ignore that. But the NHS uses a lot of new technology, new science in its hospitals as well. Right, let's get into a few more of the tricky ones. So improved access to care. That goes back to NHS. More chance of seeing a GP, better care because it's free. So your access, your ability to go and see a GP is higher. And right, these two are a bit tricky and I struggled with this for a while. So the first ever magic bullet is discovered in 1909. It's discovered by a German called Paul Ehrlich, which I should spell his name correctly, E-H-R. Yep. He discovers a magic bullet for syphilis, a sexually transmitted disease. Now, the difference between a magic bullet and an antibiotic is a magic bullet targets a specific germ, a specific bacteria. So if you have, say, syphilis, you will need to take a very specific magic bullet treatment for it. Antibiotics can be used in more general terms. So you might have a chest infection, a different infection, I don't know, an infection of a cut in your arm, and you'll just get antibiotics. So they treat bacteria more generally, whereas magic bullets are a specific type of bacteria. The story of antibiotics is quite strange. So in 1928, Alexander Fleming discovers it. He goes on holiday and leaves his petri dish out. When he gets back, the mold has been replaced, and by chance he has figured something out that cures the mold or that cures the bacteria that they couldn't get rid of. It's a big issue during World War I in trenches. Unfortunately, he can't prove it. He gets no funding, the government doesn't care about it, so he just ignores it in 1928. And then towards the late 1950s, when World War II kicks off, two other doctors, Florey and Chain, they start to look at penicillin again. This time they prove it. They can prove it works on mice. They understand the science behind it. They test it on a policeman, Albert Alexander. Unfortunately, he dies because they don't give him enough doses, but they realize it can cure infection. That's what it does. Yeah, it cures. If you have something infected, you'll be told to go and take antibiotics. Good stat for you to remember is in 1944 at D-Day, they send 2.3 million doses because the US government is funding them by giving them a lot of cash because they need it because they're at war. 38, no one really cares about it because Britain is not at war. Whereas by World War II, it's obviously a really big deal. Right, now we move on to like modern high-tech medical surgical treatments. There are loads of things here, loads. Again, think about your own lives. Keyhole surgery is where there's a very tiny precision made. It leaves less of a scar. It leaves less problems. We've got robotic surgery. This is where rather than using a human hand, they'll use a robot, so it's more steadier. There are other big things. For example, the first ever heart transplant. They can do kidney transplants, lung transplants, but the first ever heart one is 1967. Shows that date is as easy to remember. Again, there's loads of different higher medical surgical treatments here. Keyhole surgery, robotic surgery, there are others as well. Blood transfusions, just think about anything they can use. Chemo, for example, radiotherapy, all of these. Easy. You're sick, you need treatment. It's very high-tech surgical, whereas 200, 300 years ago, it was nowhere near the same. We don't really study this much, actually, but in terms of mass vaccinations, think of when you go to school, you get offered vaccinations. Babies, when they're born, they get offered jabs about 8 weeks, 1 year old, for example. So we have an approach to medicine where we try and prevent, not cure, mass vaccinations. Some of the most important ones in the country, which again, we don't see today because no one really gets it anymore. Polio became a big thing in the 1950s. The MMR, 1988. The MMR is one of the ones that you get in school. And again, easy government lifestyle campaigns. Think of your PSHE, your PD lessons in schools. Think of your assemblies where we talk about testicular cancer, where we teach you about the dangers of smoking. Think about things like Stoptober, 5 a day, right? The government is constantly telling us to eat well, to get healthy. These are all lifestyle campaigns. There are too many to even mention here. Think of public smoking bans in 2007, for example, cigarette packaging, public health education. All of this is because treatment is expensive. So the government wants prevention, not cure in the modern era, because treatment costs a lot of money, whereas prevention does not. Right, very, very last but not least, good news. I've done Fleming, Florian chain. Lung cancer is the case study for this one. It's very simple. We've already sort of mentioned it, to be honest. So it's the most common, especially in men. Breast cancer, sometimes in women, is form of cancer. Think about what the government has done. Think about government involvement. Plain cigarette packages. The 2007, we've already mentioned. Public smoking bans, so you can't smoke in restaurants, in pubs, for etc. Think about all the things the government has done in regards to smoking, PSHE, again, prevention, not cure. Think about how you diagnose it, CT scans, think about how you treat it, chemo, radiotherapy, pretty easy one to know about. We've already done science and technology in terms of diagnosis and treatment. Think of things like CT scans. Early diagnosis is recommended, so see your GP. NHS will run tests on people for lung cancer, same as women. They'll test women at high risk of breast cancer quite regularly. Again, it's all about prevention. And last but not least, all of government. Right, I think we have made it. Actually, I thought it would take 45 minutes. I'm a little bit quicker. So I'll end. Just remember, basically, this is the course. We have medieval, we have Renaissance, we have industrial, and we have modern. Then we have lots of individuals that fit into these categories. Treatment, prevention, then a few other minor ones: diagnosis, government, technology, hospitals, and surgery. It sounds really easy when I say it like this, but you need to know 1250 to 1500. What was the cause? What was the treatment? What was the prevention? What was the diagnosis? Then fast forward to 1500s. What's changed? Are there any new causes? Or has it stayed the same? AQA, or continuity, also known as continuity, yet stayed the same. So for each part of the course, great idea is to make an A4 sheet of paper, each time period in it, time period 1, 2, 3, and 4. Let's say you do one for calls. Write down all the forms of calls, highlight the ones that have changed. And if you do that, you would essentially go through everything I've done on the course. Right, I'm going to record a separate one on World War I because that's already long enough. Remember, go back, watch this in certain parts. If there are certain bits you need to check your own notes against, check your flashcards. Everything's on student resources on the school website. Anything else you need, just let me know.